Okay, he's preparing.
So CC&B, no? Like that.
Yeah. Let's see. Arriving. Yes, we are live. So watch out. Yeah, it's okay.
So, Caterina, do we start the sharing or we still wait for a little bit?
Yes, please, if you want, but just wait 1 second. Just
Yeah,
wait.
of course. Yeah, no rush.
So I think we can wait a couple of minutes more.
Sure.
Oh, good morning, Andrea.
Good morning.
Morning.
Hi. You
Good
are in a
afternoon,
nice
actually.
place. Good
Yeah,
afternoon. You are in a very nice place, Andrea.
Yeah.
Apparently.
Apparently.
Yeah.
The Prosecco Hills.
Okay, secco is very nice. So since maybe a couple of other people will join us, but I can start to introduce our guest today. So I want to really thanks a lot Gino to be here with us. I think many of you knows Gino. Gino is professor of strategy and organization at STEM School of Business, New York University. I think he has a long career with a lot of publication, so I don't want to, it's too long to read all your CV. He's an active member of the Academy of Management Association since 1999. I think this we can highlight. And today he will give us this talk, very interesting about, I think, biological stuff, because it's related. The title is Functional Diversification and Exaptation, the Emergence of New Drug Using in Pharma Industry. Thank you so much to be with us. He's in sabbatical, so we are happy that you still are, you were able to join our seminar. Thank you so much.
My pleasure, yeah. Can we start sharing the screen now? Okay, let me then share with you my slides. Can you see them? Okay, so thanks a lot for the invitation. I think actually being on sabbatical is a privilege. So it's actually the right time to present your work without being stressed about teaching and other administrative work. So this presentation revolves around a joint project with Pierpaolo Andriani, who many of you know from previous interactions at conferences or through his interesting work. It's a part of a research project that is kind of forthcoming in industrial and corporate change. So I'm happy to share this paper with you and hear what we have to say. I mean, basically we have, this is also part of an ongoing research agenda with Pierpaolo, so any comment, feedback is really relevant for not just this paper, but also our ongoing research agenda. And I have to also acknowledge that Pierpaolo has been in many ways the driving force of this project, so I was very happy and pleased to work with him on this project because we share lots of interest and it's also a real pleasure to work with him. Okay, let me start with an example that comes from a firm, although our paper essentially revolves around the pharma industry, so it's not at the firm level, but this example at the firm level is very useful to sort of introducing what we are trying to accomplish in this paper. So this is about the ChemCore project, a project that Corning started in 1962. And the idea was to develop a strengthened, flexible thin glass that was, at least that was the initial intention, to be used for eyeglasses, safety eyeglasses, and also for windshield glass in cars. This glass actually didn't succeed. The two target markets eventually opted for alternative types of glasses. And Corning, at some point, early, late 60s, early 70s, decided to shelve this project, but not to forget it. I mean, that is the typical approach that Corning has used throughout its entire history. Until when, in 2007, Steve Jobs asked Corning to produce a very thin glass for the smartphones, for the iPhones, in other words, with certain characteristics. Corning, in 6 months, so typical Steve Jobs style. I want something as quickly as possible. And Corning, of course, said, we cannot produce this glass in 6 months, but let us think about it. And the interesting response was to resurrect this ChemCore project because Corning, as I said, kept memory of this project and realized that some of the features that Steve Jobs was demanding for the iPhone were actually exactly the features that this glass had. Of course, I mean, the glass was refined, was perfected, but the point here is that glass, more broadly speaking, that technology, if you wish, was not created from scratch, was in a way used for a different application than the original one, with obviously some adjustment. So the example, although as I said, this is at the firm level, but in our paper we look at the pharma industry as a whole, illustrates what we call functional diversification. And I will elaborate on why we call it functional diversification. And the idea here is that certain resources, for instance, technologies, in the previous example, the ChemCore glass that became to be known eventually as Gorilla Glass, have many more applications, potential applications than the ones that were anticipated or taught at the very beginning. And this idea of functional diversification is kind of, in a way, similar to the idea of diversification, product diversification, but also different because the underlying process driving functional diversification, we argue, is kind of different from what typically product diversification looks like. So in other words, product diversification sometimes is developing a new product from scratch. In this case, I mean, the product or the resource exists already. Okay. So let me try to get more into the core of what we are doing. So when we talk, if you think about functional diversification, there are two essentially. And by the way, functional diversification, to be precise, is a process through which new uses for existing resources emerge. That's the way we conceptualize functional diversification. And the process by which these new uses emerge can be either inherently random, so it's not easy to predict how these new uses emerge and also under which conditions they are more likely to emerge. Or they might, on the contrary, exhibit, the process might exhibit some underlying empirical regularities that obviously might inform the entire process and therefore make the process not random, but to some extent manageable by organizations. Obviously, our claim here in this paper is that functional diversification resembles to a process that exhibit empirical regularities. In other words, it's not purely random. And I will try to show why we argue this way. Then obviously, but this is not the purpose here, the implications for search, you can easily understand, are very different if you think of functional diversification as an inherently random process, or a process that, on the contrary, exhibit some empirical regularities, correct? Because the search would be very different in both cases. And the way you think about managing the two processes would be very different. So before I show you some empirical analysis and talk about what we are doing in using our data, I just want to very briefly go through some of the theoretical perspectives that are kind of dealing with the emergence of new uses. In other words, they are relevant to understand functional diversifications, although our focus in the paper is primarily on the literature on exaptation. But other theoretical perspectives have kind of address the same fundamental issue. The first one is Penrose's resource-based view of the firm, although her focus was on understanding what drives the growth of a firm. Her conceptualization of resources is extremely relevant in this particular paper, and to understand in general new uses emergence. And then the other theoretical perspective is the literature, which is not as well developed compared to the other two, but the literature on shadow option, which is kind of a subset of real option theory. And then, of course, as I said before, exaptation, and particularly the exaptation in the context of innovation. Any question here, clarification question, or something that you want to clarify before I continue? Or?
That's my curiosity, sorry, just my curiosity. This Penrose is the same Penrose that won the Nobel Prize? No, it's another one. Sorry, this is my ignorance. The Penrose is the same Penrose that won the Nobel Prize? No?
No. Is Edith Penrose, an economist. She wrote several things, but the famous quote is she wrote a very influential book, also in the context of the resource-based view of the firm, later on the growth of the firm and the role of resources and capabilities and managerial insight in the process. Okay. Let me briefly go through some of these theoretical perspectives, which actually, although they address issues at different levels of analysis, but in many ways they complement each other. So what in this paper we try to do is to make a first step to develop an integrated framework where these three perspectives can be integrated, although our focus is primarily on the role of exaptation and functional diversification. But as I said, I mean, it would the next step would be to integrate even more the other two into an integrated, unifying framework. So Penrose briefly explain, I mean, conceptualizes resources as bundle of services. Some of these services are currently in use. Others are still unused. So the idea is that resource embodies many more services that are currently in use at any particular point in time. And some of these services, by the way, can be known to the firm that decides not to use that resource for other alternative applications, or some of these services or functions, if you wish, are not necessarily known to the firm. So the question is how you discover them and whether or not is in the best interest, of course, of the firm to exploit them. But in many ways, if you go back to the example of Corning and Chemcode project, Corning had no idea about the next application 40 years down the road, correct? When Steve Jobs contacted Corning. But so that was a service, a potential application that was unknown to Corning at that particular point in time when Chemcode was initially developed. Which also suggests that the opportunity space available to a firm based on the type of resources that the firm has created or acquired over time is much larger than one can simply infer by looking at the current uses of those resources, correct? This is actually very important for the idea of functional diversification, because eventually implicit also in Perot's conceptualization is the idea is that these resources over time may find new applications, and managers actually part of the role of manager is to identify some of these unused services that could become actual applications. Okay. The problem is that apart from a general reference to this idea of managerial insight, I mean, Perot doesn't really elucidate how novel uses emerge. So we managers, in other words, have the ability to identify and discover these new applications, but I mean, the process by which this occurs is not very clearly articulated. This is not to diminish the insight of Perot's. Her argument is very powerful, but what we need to understand better is the process through which these new services, new applications, new functions are discovered. Shared options theory, again, briefly explain, kind of looks at the same fundamental issue. The idea is that a particular resource, again, embodies hidden opportunities in the sense that that await recognition. The argument is pretty much, in at least the core argument, the basic argument is very much in line with what Perot had already argued about years earlier, correct? The idea, in other words, is that you make an investment in a particular technology. The technology is meant or designed to perform a particular function or to be used in a particular way, but there might be hidden opportunities, in other words, alternative applications for that technology. Again, the Kencor case is a very enlightening, illuminating, if you wish, case, and many other such cases could be made, of course. So essentially, the idea is that how you recognize these shadow options and how you turn them into real option, that eventually the firm decides to invest or not, to invest in or not, depending on obviously its assessment of the market opportunities and so on and so forth. But the idea is that a real option is already an investment made with a particular goal. So it's known to the firm, but a technology, a resource more broadly speaking, may also embody these other options, shadow options that the firm may or may not know when the first investment is made. So again, the process, how you recognize that, how you learn about these options. Then, of course, exaptation theory is kind of, again, looking at the same fundamental problem of emergence, novelty emergence. In this context, of course, we are interested in the emergence of new uses for an existing resource, primarily a technological resource. And the insight from exaptation theory is that innovation is not always the response to a particular problem, a specific problem. Innovation many times is identifying new applications, new functions, new uses, if you wish, for an existing artifact, for an existing technology, for instance, for an existing resource, more broadly speaking. And this is the result of a functional shift. I mean, the same resource can be used without necessarily major transformation, can be used for other applications, for other functions. So this is the idea of functional shift that is in many ways the essence of exaptation. One of the strengths of the exaptation perspective is the idea of functional shift, and also the idea that if the functional shift is what drives exaptation, clearly functional search is an important search in organizations. I mean, if I look at the history of Corning, that is a company I've studied in depth for many years. In addition to developing something new, much of the search at Corning has been finding new application for existing technology. Cancor is a good example, but I could make many other examples that pretty much are consistent with the Cancor, the Gorilla Glass example. Okay, so as I said, these are the three main theoretical lenses that we are drawing from, although our focus is primarily on exaptation for the reason that the exaptation lens, as already mentioned, provide a very important starting point, this idea of functional shift, functional search, that might be an important source of novelty. By novelty here, we are referring to the emergence of new uses or functions for existing resources, okay? Okay, that being said, there are several questions that more or less explicitly we are trying to address in this paper. For instance, is it possible to measure emergent uses? For instance, how many, in other words, what is the percentage of these emergent uses that are functionally novel and therefore inherently adaptive? And what is the time of emergence of these uses? Are these emergence, is this emergence, as I said at the beginning, an inherently random process, or there are some empirical regularities that we can identify that might also help managers, for instance, enhance the ability of a firm to generate new applications for their resources. So there are several questions, and I will try to show you and hopefully convince you that what we are doing is an effort to address some of these questions, correct? And as I said, feel free to interrupt me if you have any clarification question. Otherwise, we can have questions at the end. But for me, it's fine if you interrupt me along the way. So in order to study this phenomenon of functional diversification, we focus on the pharma industry for the reason why we chose this context are those listed in my slide. But essentially, the idea is that each drug carries a unique chemical signature and is approved for specific conditions. The identification of drug uses is straightforward to the extent that a complete set of uses is available in international databases, and each use is unambiguously associated with the drug. The initial drug use of a drug can be easily identified and corresponds to the approved use or the first published use. And the time of appearance of a use is relatively easy to determine. So these are some of the main reasons why this context is very useful. We sort of follow a similar approach studying Corning over time. It's not part of my presentation, but it is actually an extension of this project at the firm, not at the industry level, okay? So because of these reasons, it is possible to document and establish whether some regularities or patterns can be identified. Therefore, address the fundamental question whether the process of emergence of new uses is inherently random or, on the contrary, exhibits some empirical regularities. Okay, so this is very important, crucial to clarify, because otherwise we wouldn't be able to address that fundamental question. So the data, quickly. So data on drugs are data on approved drugs by the FDA between 1998 and 2000 that are based on new molecules, or what are called also new molecular entities. The set of uses of these drugs for that period were obtained from DrugDex, which is a professional database developed by Micromedex. And this is a very important database because for our purposes, because this database collects drug uses by scanning the academic and practitioner/professional literature. And the sample of drugs, because of we are focusing on the 1998 and 2000 years, is relatively old to allow for a long enough time window for new uses to emerge and stabilize, correct? I mean, as I will show you, new uses emerge over time, although they are concentrated in the first few years since the approval or the first utilization of a particular drug, but some uses emerge over time, at a later point in time. And therefore, having enough years after is important to capture the emergence of new uses in a fairly comprehensive way. Just to give an idea, so you have a new molecular entity, okay, that is also documented in the database, DrugDex. From there, we extract uses, in other words, not only the original one, but also the subsequent uses for each of these new molecular entities. And then we identify whether the first approved use by the FDA, because this refers to drugs in the United States, or and then the emergent uses. Sometimes the original use was not approved by FDA from the beginning. It was a use that the drug had even before the approval of the FDA. So in that case, the original use is not the approved use, is the first use based on research that we conducted by looking at scientific or professional publications. And then, of course, we have the subsequent emergent uses, which are called off-labels in the relevant literature. Eventually, some of these emergent uses, by the way, could be approved by the FDA, okay, but not necessarily. And based on this, obviously, we construct most of our measures, okay? Any question here? Because I think it's important to understand the data structure to also understand what we are doing and why we can do the things that we claim we do in the paper, okay? So if you just look at new emergent uses, what is kind of striking is to see how the large majority of artifacts, by artifact we mean drugs in our kit, right? We want to use a general term, could be also any other type of resource. But in our context, the large majority of drugs, 85%, exhibit emergent uses, on average 5.3 per drug, which is kind of interesting, correct? That shows that each drug, on average, has 5.3 on average, let's say 5 new uses, different from the original one. Some of them significantly different. I will show you in what sense they are significantly different. And most of these uses are 77% are emergent and appear after the drug becomes available for wide utilization. So after, for instance, the FDA approval, or after the first time that drug was mentioned in a scientific or professional publication. So just counting the number of new uses is of course a first indicator of novelty, but it doesn't tell you how novel the drug is in terms of the type of function, the type of disease, or that, for instance, the drug treats. So that's why we developed this functional novelty, which measures the distance between the original drug use and its emergent uses. And to this end, we exploit the unique structure of the International Classification of Diseases, which looks very much like a hierarchical tree with 17 large classes at the top that eventually branch out towards more specific classes. I will show you an example to clarify provide you a visual representation of what I'm talking about. The idea is, like, I don't know whether you're familiar with patents, but even if you look at patents, it's pretty much the same hierarchical structures. We have broad patent class and their subclasses, correct? This is pretty much the same logic. Just to give you an example, this is actually the IDC9. Think about the large category 8 disease of the respiratory system. Then you have within that large broad category, you have subcategory pneumonia and influenza. And then, of course, within each this subcategory, you have smaller other subcategories, correct? And then both for pneumonia and for influenza, okay, depending on the type of influenza that you are considering. This is very important for us because we exploit this tree-like structure, hierarchical structure, to build our functional novelty measure that, as I said, depends on the distance between the original use and the subsequent uses. So to be more precise, we identified 3 types of bifurcations. First order bifurcation, which refers to transition between major disease categories to which we attribute a distance value of 1. Okay, so we chose this. I mean, this is obviously our choice, and there is some level of arbitrariness here, but is what we thought was the best way to eventually differentiate different types of bifurcations. The second order bifurcation, on the contrary, refers to transition between subcategories within the same major disease category, and to which we attribute a distance value of 0.5. And then we have the third order bifurcations that refer to transitions within the same subcategory to which we assign a distance value of 0.1. So basically minimum distance. That means that first order bifurcations refer to new uses that are functionally distant from the original one. Then you have intermediate distance for the second order bifurcation, of course, minimum distance when the new use, the new application of the drug is pretty much similar to the original one. So look at, for instance, again, going back to the example before, you can think about molecule developer influenza, so in this subcategory, and then new uses that radiates, okay, in different directions, correct? You can have a new use that is not classified under disease of the respiratory system, but disease of the circulatory system. Okay, and that it would be a first order bifurcation. That means that the new use of the original molecule, the original drug, is really distant from the original application. Then you have second order bifurcations where you have transitions, as we discussed before, from the original application from the original subcategory within the disease and the respiratory system class into other subcategories. And then you have transitions within the same subcategory, okay? Those are the third order bifurcation, minimum distance, okay? Any question here? Is it clear what we are trying here to understand? Of course, I mean, we also analyze through other channels, through other sources, basically tracing the history of some of these drugs, whether in the literature, the relevant literature, these transitions, these new applications are considered to be truly functionally novel. So we are using this database, but we are also drawing from other sources to double check that our understanding was correct. So this, just to summarize some of the descriptive statistics. So you can see how when you have first order bifurcation, emergent uses tend to be frequently exaptive in nature, which is to be expected, correct? Because these are situations where the new function, the new application, the new use is functionally different from the original one. So that is a typical case of exaptation. So most of the first order bifurcations tend to be exaptive in nature. That is less likely when you have second order bifurcation, and even more so when you have third order bifurcations, where the number of where the functional distance, as I explained before, is minimum, and therefore exaptive events are correspondingly very rare, correct? Because there is no real functional shift, or at least only in very few cases you have a real functional shift. So then so this is a first important pattern, and I will elaborate on that towards the end. But another important thing that we are interested in is the time of appearance, correct? In other words, is the time of appearance of these uses, again, random, or there seems to be some sort of regularity, empirical regularity. So what we observe here is that most, I would say 50% of the uses appears in the first 4 to 5 years. Actually, 80% of the uses around the 11th and 12 years since the approval of the first use, or the first use became known. And of course, other uses emerge over time, less frequently, but they continue to emerge. And by the way, for practical reasons, we stop at year 2013, so we cannot rule out a priori the possibility that after that date, new uses might have appeared for the drugs in our database. We don't have data for that, but that is something that we cannot exclude. I mean, that goes, it's very consistent with the idea that it's impossible to anticipate all possible applications of technology, a resource, more broadly speaking, an artifact. Okay. So there is no upper bound, a defined a priori. What we show here is a lower bound, if you wish. Okay. Okay, let me skip this one. Then, based on what I showed you before, we try to think more about combining the number of new uses with the functional novelty, and we develop by combining these two measures. We develop another measure which we call novelty generation factor. Sorry for the language, but we had to use a different language to understand, to convey what we were trying to show. The idea here is that you may have drugs that have generate lots of uses over time, but none of them is functionally novel. In other words, the new uses are very much small departure from the original application, the original function. But you may have, on the contrary, drugs that have fewer uses over time, new uses, emergent uses, but each one of them is functionally novel. So how the two measures combine determines the novelty generation factor. Okay, so just to give an example, these are two drugs in our sample. I mean, these names are difficult to understand, but montelukast, I hope I pronounce it correctly, was originally approved for asthma in 1999, developed 9 emergent uses over the time window that we are considering, some of which are related to asthma. Chilostazol, 1999, so same year, has 9 emergent uses that address cardiovascular conditions similar to the original one, which means that in terms of novelty generation factor, Chilostazol is less obviously innovative, less innovative, yes, than montelukast, although they have the same number of emergent uses, correct? So that is interesting because you can show here how, if you look at the novelty generation factor, the distribution is like a long tail, correct? Which is kind of to be expected. So that means that there are few that are truly novel, even controlling for the number of new uses, and many others that are not as very novel, even if they have the ability over time to radiate and generate new applications. So the distribution of the novelty generation factor is strongly asymmetric and long tail. And this is another example, but it's pretty much consistent with the one that I showed before. And even when we standardize, what emerges is that there are drugs that are using the language that is also used in biology, are multifunctional. In other words, they have this inherent ability to radiate into many different applications, some of which very distant and very functionally different from, in other words, from the original use. I mean, it's not surprising. I will show you also another graph that thalidomide is one such drug, and also sildenafil is one such drug. I will show you something else that further illustrates the point. But the point here is to really show how certain drugs, given the number of emergent uses over time, might be very novel because they really radiate into very distant applications, in this case, drug applications. So exactly the thalidomide. If you look at thalidomide, was developed originally to treat insomnia, and it has over time radiated into many different directions. By the way, most of these applications are functionally distant from the original one. So most of these cases over time, you can see over time, many of these new applications emerge for thalidomide are exaptive in nature, precisely because there is a clear functional shift. This is not necessarily true for other drugs, but thalidomide and a few others really exhibit this interesting pattern of radiation, if you wish, over time. And interestingly, you can see the appearance of new cluster. I apologize, the figure is a little bit small, but there are, for instance, C2 neoplasm, C12 skin diseases, a C1 infection. And what does explain the appearance of these clusters? What explains that, in other words, the underlying factor here is what is called in pharmacology mechanism of action, okay? Which explains eventually why certain drugs are sort of predisposed to radiate and generate so many new emergent uses, some of which, or many of which, are functional. Let me elaborate on this idea of mechanism of action, which is very important to understand why we observe what we observe. By the way, if you want to use a different language outside pharma, instead of using a mechanism of action, you can think about functionality in the context of technology, for instance. Okay, it's kind of similar concept. Okay, so let me skip that. So mechanism of action. So these mechanisms of actions in pharmacology refer to the set of interactions through which a technology, in this case a drug, delivers an effect. In particular, a mechanism of action is the set of biochemical reactions that follow the binding of a molecule to a receptor and deliver a pharmacological effect. Regardless of the technical language, and I think that the point here is that some drugs might embody only one mechanism of action, which means that the range of possible uses over time is much more limited compared to other drugs that, on the contrary, embody different mechanisms of actions, like in the case of thalidomide, correct? So there is an association between the number of mechanisms of actions of a drug and its the subsequent emergence of new uses, and how novel these uses are from a functional standpoint. So the more mechanisms of actions a drug embodies, the more, for instance, the more likely is the drug to engender the emergence of new uses that are also exaptive in nature, okay? In other words, more distant from the original one. And obviously, the important point here is that some of these mechanisms of actions are unknown to pharma companies or scientists or researchers in the pharma industry. Some of them are known, or they become known over time. So it could be that, for instance, you use a particular drug to treat a particular disease, but then there are some side effects, or at least unanticipated effects on the patients that reveal the potential of this drug to, for instance, cure or treat other problems for that patient, correct? That means that drug has not just one single mechanism of action, but other mechanisms of actions that can be leveraged to redeploy, if you wish, or repurpose, as people in the industry say, that drug for these new applications. In other words, these mechanisms of action provide an anchoring point, if you wish, to understand why some firms, some resources have this inherent creative potential, and why they embody a bundle of hidden services that some of which are unknown to the firm, for instance. Okay, is that clear? I mean, these are very important concepts, because I mean, once these mechanisms of action are understood, and maybe in many cases even theorized upon, the ability to anticipate or see other applications, other uses, other functions for these drugs is enhanced, correct? So understanding these mechanisms of action is very important to fully discover the creative potential and take advantage of the creative potential of some of these drugs, and more broadly speaking, of any resource. I mean, going back to, for instance, to outside pharma, sometimes, I mean, I even through my interviews with Corning over time, people that have accumulated years of experience with for instance, glass making of specialty glass, they understand glass properties, correct? What kind of functions a particular type of glass can perform, regardless of whether the glass is currently used for that particular function. So there are applications, in other words, that can be sort of anticipated. Then there might be other properties, functionalities of the glass that are not anticipated, and they might become apparent later on when you apply this glass for something, and then you discover this that this glass can be used for other applications, but that is something that only occur at a later point in time, correct? But in many other cases, as I said, regardless of whether you use a particular glass or technology for that particular a new applications, you know that new application is a possibility, correct? So it's kind of pretty much the same fundamental logic here. I'm stretching a little bit, but just to make sure that we understand each other. Okay, so this is just to re-emphasize what I said, and I will show you something that illustrates exactly this point. The number of mechanisms of action is correlated positively with the generation of novelty, meaning the emergence of new uses, and also the number of exaptations, which suggests that functional novelty, at least in part, depends on the discovery of new mechanisms of action. So this pretty much captures what I have said. So if you look at the relationship between number of mechanisms of action, novelty generation factor, exaptive events, you can see how, on average, there is a positive association or correlation, if you wish, between number of mechanisms of action, novelty generation factor, and number of exaptive uses. So new uses that are exaptive in nature. Okay, so that is pretty much. So again, this is a sort of an empirical regularity that we identify in this context. Okay. Okay. Then the question is that do more innovative artifacts, again, more innovative drugs, will explain what it means, generate more innovative uses. Okay. So what we do here is we distinguish drugs into two main groups: what we call first-in-class and derivative drugs. And the innovativeness, and we want to understand to what extent the degree of innovativeness of a drug affects not only the number of new emergent uses, but also how novel they are, and therefore whether or not the innovativeness of a drug also implies that certain drugs have a much higher ability to radiate into new applications. Innovativeness here is defined in terms of chemical novelty of the drug, and as I said, I mean the first class is first-in-class drugs. These lead typically to a new pharma category, and derivative drugs, on the contrary, the other category, are drugs that fall within an existing pharma category. Okay, so you can think about something that is creates a new category or subcategory, and a drug that, on the contrary, is pretty much a variation on the theme, correct? So it falls within an existing category. Again, what we observe here is to be, consistent with what you would expect, is that even if the number of emergent uses may be on average more higher for derivative drugs, which is not surprising compared to the first-in-class drugs, the novelty of these emergent uses is on average much higher for derivative drugs, for first-in-class drugs than derivative drugs. the number of new uses that are exaptive in nature, that in other words, that imply a real functional shift, is higher for first-in-class drugs. The time that it takes for these emergent uses to emerge is longer for first-in-class drugs, obviously. And then these first-in-class drugs are also higher impact in general. In other words, they treat new diseases or they improve significantly on existing treatments. Okay, so this is how we capture impact, whether they treat new diseases or they improve significantly over the existing treatments. Okay, again, this has been double checked by looking at the existing literature for each of these drugs. Okay, so using multiple sources to double check and triangulate and validate our understanding and our obviously classification between the two groups. Then one last point, and then I want to wrap up. So what we do here, we want to understand is whether this radiation exhibits any consistent pattern. In other words, drugs radiate into other applications sort of randomly, or there is some sort of directionality. In other words, the donor, the category in which the drug was initially classified is likely to donate to other categories, certain category, or there is no logic in the way that the process unfolds over time. So in other words, it is inherently random. In other words, we are interested in understanding whether there is a preferential direction. Okay, and let me show you what with an example, what we found. But obviously, other similar graphs could be drawn for other classes. So you can see how class 6, which is nervous systems, so diseases of the nervous systems and sense organs, seems to be a substantial donor to class 5 and 2 and 9. So you can see how for drugs that are in class 6, the emergent uses tend to be more frequently concentrated in class 5, 2, and 9. Okay, so much less with respect to other classes. The preferential direction between class 6 and class 5 is not surprising, because class 5 refers to psychiatric and nervous system disease, and which are obviously related. But the donation, if you wish, towards class 2 and 9 are slightly more difficult to understand, but still reveal that there is some preferential direction even towards them. So here the point is that even when it's not immediately obvious why one class donates to the other, still you observe this preferential direction. Okay, so it seems that donation tends to be concentrated on one or just a few classes. In some cases, it's very intuitive. In others, I mean, deeper investigations is required. That actually goes beyond the purpose of this paper, but it's really what we think would be the next step. Okay. Let me skip. And by the way, one thing that I want to highlight here is that about 3/4 of these jumps involve functional shift, so they are exaptive in nature. Obviously, there might be other jumps that don't imply any functional change, so they are not exaptive in nature. But here we primarily focus on jumps that are first-order bifurcation. Okay, so not to complicate too much the graph. Okay. Okay, so to summarize, any question? Anything that you want to ask?
Maybe
Please.
I have a question related to the last the last results that you were discussing.
Yeah.
Is that possible? Yes, because it's pretty, for me at least, it's no, it seems very strange, that nervous system, and you can use in neoplasma, is really unrelated. Also, digestive system is completely unrelated. Is that possible? That was wrong, the first use in neural system? I mean, was not working, was supposed to, not successfully, I mean, is that possible?
That's possible. That's possible. Actually, what happens sometimes is that maybe certain drugs approved for a particular use might prove themselves to be much more effective in treating other diseases, correct? So that is possible. I agree with that. In many ways, you can say that even thalidomide actually has been more useful for other uses than the original one. So I completely agree with that. That is highly likely. Yeah.
Okay, thank you.
I mean, partly because, which is actually quite interesting. Thanks for the question, because I want to make sure that, and I don't want to repeat myself, but from an evolutionary perspective, if you wish, what actually is interesting here, but that could be also true if you embrace the Penrose perspective about resources, is that a resource, once created, is sort of a living entity, correct? It evolves, and resources evolve as they are applied to different applications, correct? And therefore, they might actually reveal functionalities that maybe initially were not imagined or fully understood, that could be much more relevant than what the original function was, correct? Think about ChemCode project, correct? In many ways, you can argue that using that type of glass with some adjustments, of course, with some refinements to satisfy Apple's demand for iPhones, has triggered a very important new market for cornea. Okay. And by the way, I will show you at the end another graph that pretty much illustrates the same type of radiation for specific technologies developed by Corning. And actually, Corning has always thought that way. We have to develop breakthrough technologies, new technologies, in this case, new specialty glass, for instance. And these glasses eventually will span many new applications. So that is the way they think. It's not just developing always something new from scratch. We also have to think about how to use or repurpose, if you wish, these different types of glass for different applications, sometimes very distant from the original one. Okay.
Gino, may I ask you something?
Please, please, please.
How does this concept relate with the concept that is typical in patent analysis, that is the one of technological relatedness?
I think it is related in many ways, because you can think about, let's say, if you go back to the idea of distance and the bifurcation, obviously there are bifurcations that second order and third order bifurcations tend to be much more related to the original use, correct? So in that case, the functional shift is much less likely. That's why you have even, let's say, uses that are not necessarily adaptive in nature. Some of them are, but they are much more rare, obviously. The first order bifurcation, on the contrary, tend to be overwhelmingly adaptive in nature because there is a functional shift. So in a way, they are related. I completely agree. The interesting thing for us is that here we are talking about relatedness in terms of how different the new application is from the original one, correct? If there is truly a functional shift or not. When we talk about related diversification, sometimes it's more in terms of the market that you satisfy. Whether or not you can use the same resources or not, and that is a different story, correct? And it's not entirely clear, even if you enter in a completely different market, whether the functionality of the resource is a new one or is still the same, correct? So in other words, whether there is truly a functional shift or not, even if the market might suggest that there is, because it's a different market from the original one. But sometimes maybe you can still have a very different market, but the technology or the resource that you leverage are still essentially performing the same function, correct? So that is another interesting question to address, which is not as clear sometimes in that literature. That's why I think this idea of functional diversification is a little bit, I mean, it's very in line with the literature on diversification. We don't want to claim that it's not, but provides a slightly different lens through which we can look at it. Does that make sense? Okay, let me, unless there are other questions, feel free really to interrupt me. I mean, but let me summarize quickly some of the, let's say, key insights from these analyses. And so the first finding is that existing technological resources, in this case drugs, have the potential to generate new, often unexpected uses. Okay, so this is actually the first basic finding, which is not as which is pretty intuitive also in light of the previous literature, but not always clearly documented. Correct? And the interesting thing here is that most uses emerge, at least in our context, after market introduction, so after the drug was used, which means that by using it, also this potential is revealed. One important thing, for instance, is to keep in mind is that by using, for instance, a drug, new mechanisms of actions sometimes have been discovered by watching, observing the effects of these drugs. Not always necessarily through additional R&D investments or lab experiments. Sometimes really looking at the effects on patients. Okay, and that's why, for instance, many pharma companies have also incorporated the feedback coming from physicians prescribing these drugs and over time observing effects of these drugs that were not really anticipated. The second one is the emergence of new uses follows two distinct patterns. You have proximate emergence, which refers to the appearance of novel uses in the proximity of the original use or uses that are characterized by a lower degree of functional novelty, emerge relatively early, and contain fewer higher impact events, and on average less exaptive. They are less. They tend to be less non-exaptive in nature, although there are a few of them. When, on the contrary, you have distance emergence, you refer as I try to show you, we have a higher degree of functional novelty of the new uses. And these uses tend to be a more high impact. They exhibit, they take longer to emerge, so the time of appearance is longer. They typically rely on a much larger number of mechanisms of action, tend to be associated with more innovative drugs, and tend to be also exaptive in nature. So functional shift is really the driving force, if you wish, for this distance emerge. The other finding is that there seems to be a correlation between the diversity of the context to which the technology, in this case the drug, is used or exposed, and the emergence of unexpected functionalities, what are called, as I said before, mechanisms of actions in the pharma. In pharma. So the idea is that when a drug is used in different contexts that are very different from the original one, it's more likely that new mechanisms of actions are also relevant and discovered. So even if you don't know this mechanism of action from the beginning, the application, when the more distant it is, also is more likely to reveal these mechanisms of actions that eventually are leveraged to identify other possible applications. The last finding is that the exploration of distant functional areas reveals preferential directions. So it's not purely random. Even when it's not entirely obvious why one class is a donor to other classes, what is important from the data is that this is not happening randomly. There seems to be a consistent transition from one class to another class. In some cases, as I said, it's pretty intuitive, given the type of applications. In some others, it's not obvious, but at least there seems to be like a consistent transition. So investigating why that is happening would be very important. Of course, the next step would be to examine even more in depth the underlying mechanisms of actions that could help probably shed light on this issue. One point that I want to stress is that sometimes mechanisms of actions are known, but it's not clear how they function. So because that requires some effort also on the part of pharma firms. Okay. Okay, let me. So one thing that among the implications is that this study, by highlighting these irregularities, also suggests that function-driven innovation is a critical source of innovation. I mean, if you read Brian Harter's book, for instance, he believes that, he argues that innovation is largely a response to a new phenomenon in science or technology, which activates the exploration of the possibilities and eventually leads to development of new technologies, or there is a specific need that drives the R&D effort of a particular firm, for instance. But a third channel, and something that Paolo and I have already discussed in a special issue in an Industrial and Corporate Change in 2016, a third channel is this idea of functional shift. So the form, the resource, the technology exists, but this resource or technology can be used for other applications. And that is another channel of innovation, where the form exists and doesn't have to be recreated from scratch and can be used with sometimes minor adjustments to perform a new function, can be used in a different context. And actually, this seems to have become, if you look at implications for firms, a pervasive way of thinking, of innovating, to generate innovation in the pharma industry. I mean, there is this growing phenomenon that goes under the name of repurposing, that is actually a fast-growing and increasingly important segment in the pharma industry, where pretty much in line with what I talked about so far, pharma companies try to repurpose their drugs, meaning finding new uses for their existing drugs, which are called actually off-label uses. Off-label because they are not necessarily approved by the FDA. Okay? They might eventually become approved by the FDA. Actually, if you look at the numbers, it's quite striking. I mean, I think repurposing accounts for about 30% of the newly approved drugs by the FDA in recent years, meaning that these were, they emerged and then the FDA approved them, and they were not approved when the drug was originally approved by the FDA. Actually, about a third of drug revenues is based on repurposed drugs. And I mean, and some of these drugs, repurposed drugs, sometimes are also used to treat diseases that are not as frequent, but still affect the health conditions of a significant part of the population, and for which pharma companies don't necessarily have an incentive to develop new drugs because the numbers are not as large. So one way of treating these diseases is to repurpose existing drugs if they, based on pharma companies' understanding of the underlying mechanisms of actions, these drugs, existing drugs, are considered effective to deal with some of these diseases. So again, the idea is to reconceptualize, if you wish, resources and technologies as option-rich, as resources, in other words, that embody shadow options that can be discovered or should be discovered if the firm makes an effort in that sense. And I mean, this is pretty much what, as I said, Corning has been doing. If you look at photosensitive glass that was developed in the mid-40s, that glass, that
Thank you so much. No, it was great. It was very clear. I open the discussion, please.
I have 2 questions.
Please, Andrea.
The first question is, so if I understood well, the direction is to develop technology, or basically the idea is that we can arrive to design technology for exaptation. So basically we can, so with the idea of a mechanism of action, are we looking for technology that are higher probability of generating exaptation?
Yeah, well, okay, so one first reaction to first obvious answer to that question, which is an important question, is to distinguish between, let's say, general purpose technologies and more specialized technology, correct? And that makes perfect sense. I mean, there are some technologies that are general purpose, so they are inherently option rich, correct? I mean, others that are designed for specific uses, correct? And therefore, I mean, the assumption is that they are really relevant for those uses, but it's not entirely obvious that they can be applied as easily for other applications. So clear that is in the literature, so and in the paper towards the end in the discussion we discussed that. But it's also true that there are technologies that are not general purpose that can still have these can still be option rich. The problem is just to try to identify these new applications, correct? So and for, let's say, for managers, the idea would be even when you have single purpose technologies or technologies that tend to be a little bit more specialized, they can still be relevant for many other applications. So the idea is to not to give up on searching for these applications. It's just to make even a stronger effort to identify some of these possible applications, correct? So for general purpose technologies, that is pretty straightforward, correct? But even in that case, I mean, can you, I mean, there is this idea that goes back to Kaufman, correct? That, I mean, it's very difficult to identify all possible applications, correct? That is, you cannot list them now, correct? Even for general purpose technologies. But even for them, the underlying message would be the same. There might be many more applications that you might envision right now, and some of them might take years to emerge, correct? I mean, think about the Chemical project, and you can say that that was not a general purpose technology. It was essentially maybe there were 2 specific markets for which Conin tried to develop this project and never fully, never anticipated the possibility of using that for smartphones. So that was not even, they were not even produced at that time, correct? But the interesting thing, I mean, and that for me has been very revealing, talking to people at Conin, is that they always think that what we do now, even if it's not immediately useful, can be useful at some point in time when things change, correct? So then the question how you leverage that. Well, you keep memory of what you do. Okay, so I mean, Corning, like many other companies that we can think about 3M, but that operates in a similar way, but they really try to preserve memory of whatever they do and make it accessible to future generations of scientists and researchers, correct? Through, for instance, the last effort that, big effort that Corning has made was to digitize everything that Corning had done in the past, not just patents, but papers published by the scientists. Also their daily diaries, basically the diaries that they write, in which they document the experiments that they run, correct? And so they digitize all this to make sure that every time you start a new project, you at least know what has been done in the past. What was done in the past and what has been done recently. Don't start from scratch, correct?
Yeah.
Even when something doesn't work, even when something does not work. Cancor was in many ways a failed attempt, correct? The market did not pan out, and many companies would have considered that as an embarrassment. That is not how Corning operates, for instance. So, those are considered to be learning experiences that could still have value in the future, correct? I mean, and that's how the Cancor project was resurrected. Yeah.
So I visited Corning a long time ago. So very nice farm, very, very nice. We visited because we were in Cornell for a while, no?
Yeah.
So it's not far. We
No,
go there. Very, very nice farm. So very nice. I didn't know all these stories, but anyway, yeah. Other questions?
By the way, one of the oldest companies in the United States, if not the oldest.
Yeah.
So that actually explains why.
Fantastic. It's very, very nice. And they organized, we went because my first daughter, she was small. So we went there, they organized some experience lab for kids, very well done. It was nice, amazing. Yeah, very old story. I have a little question, maybe other people. I have just a curiosity. I was thinking that, so you analyze this data set, you know, that is till 2013, something like that.
13, yeah.
Do you think there is any impact on the introduction of artificial intelligence, machine learning? Because now the pharmaceutical, no, they use actually a lot.
Yeah, I agree. I agree with that. That's a very good point. We have a couple of lines in the paper towards the end, but clearly the new technologies that the big data, machine learning, will actually help probably identify either new mechanisms of actions and or at least enhance the likelihood of identifying them. And they can also obviously help identify new uses, new applications for sure. So that is I completely agree with you. So I think for more recent years, for which some of these techniques or new methodologies, if you wish, become much more pervasive, better understood. I mean, clearly, I don't think that maybe the main regularities will be different. I will argue that they might actually help firms in the process of identifying these uses and new uses and mechanisms of actions. So I think, which might also suggest, I mean, but I don't want to claim too much, might also suggest that some of the regularities that we have identified will be even less random, correct? Because then you have the tools to understand better the creative potential of some of these drugs or any technological resource or resource that you are considering, correct? Yeah.
Yeah, thank you. Other question? I was wondering
related to this. Sorry.
Go ahead. Sorry.
No, related to this, I was wondering whether we should look also to the way people search for exacting knowledge.
Mm-hmm.
In the sense that I would think about AI scanning a database. So the way it's going to scan is going to improve or reduce the probability for finding exactive application or not. So what I was wondering is whether we should start to look at the way search for knowledge is done. For instance, I have the impression that in the pharmaceutical industry, they are looking in a specific way for knowledge compared to other sectors, basically.
I agree with that. I'm less familiar with specific firms in the biotech industry or pharma industry. Or I mean, I know what we read about these companies from other scholars. I mean, from other publications. But I think that is clearly an important point, correct? I mean, in general, even regardless of the pharma industry, in many ways, that was also the focus of my research, early research on corning, part of my dissertation, and is part of this ongoing project with Pierpaolo. I mean, corning is again part of this project, and there are multiple ways, and there is no single way by which you can enhance the exaptive. I mean, help people search with using an exaptive lens, or as a guiding principle, if you wish. One thing that, for instance, one thing that emerges, for instance, from looking at corning is that there are multiple managerial practices and organizational routines that together create an environment where this is more likely to happen. So, for instance, as I said, if you provide memory of what you do, and you provide access to this stored knowledge, correct? That is like the organizational memory, if you wish, and that obviously facilitates that process. I mean, Cancor was not forgotten, as I said, correct? It was shelved, but more in a figurative sense of the term. But people knew about it, and when they wanted to learn about it, they could go back and see the archives and find everything that corning had done about Cancor, correct? And so they didn't have to start from scratch. So this accessibility, so storing knowledge and providing easy access to that knowledge, even when something was not successful, is obviously an important condition, correct? Because that's one thing. The other important thing is that many people at Corning, for instance, spend most of their professional life at Corning. So the attrition rate in Corning is very low. Of course, Corning has fired people during periods of crisis, I mean, or laid off people. But if you look at the career of many of the key scientists and researchers at Corning, they spent most of their life there, 30, 40 years sometimes. I mean, it's not so rare or infrequent, which reinforces this idea of organizational memory, correct? People there know what was done in the past. So they can actually transfer some of that knowledge, including tacit knowledge, to the next generation. Actually, they think about some of the senior scientists and researchers as the masters that who have to teach the apprentices, so the newcomers, correct? Even when the newcomers sometimes are more knowledgeable about the latest development in science than the masters. So this is, I mean, it's just another factor that is always invoked as critical to understand how innovation takes place at Corning. But in my opinion, also as an important condition for fostering even exaptation in an organization, correct? If that is not the case, I mean, it's very difficult to see. It's much less likely, in my opinion, to see exaptive events in any organizations. And of course, I mean, which is embedded in the corporate culture, the idea that failure is not an embarrassment, it's a learning opportunity. I mean, it seems to be an obvious thing to say. It's not, correct? And it requires a different way of framing things, not as a mistake, an embarrassment, something you should try to forget about as quickly as possible because you don't want to be but something that, okay, we try, we didn't succeed entirely, but what we did can still be useful. So I could provide other examples apart from the Cancor project. So that is, I think, is very important. Very easy to say, but very difficult, hard to implement in practice, correct? In any organization. Then, I mean, of course, Corning, and one last point, I mean, partly because it has been so far, until recently, like a family-run company. I mean, in other words, the founding family has been present, has sort of shielded the company from the stock market pressure. They actually mentioned that multiple times, even in my interviews. So the idea is that they understand that in order to develop to be an innovative firm, it takes time. So you can't always listen to Wall Street, correct? And so you have to listen to what scientists and researchers say, correct? I mean, if it takes 10 years to develop a technology to bring it to fruition, you still have to make investments, even if it doesn't look good on the balance sheet. But maybe after, you might actually harvest the crop, correct? I mean, but you have to have that mentality. If you always want to show good numbers every quarters, or that doesn't work in some of these, for some of these R&D intensive firms, correct? Yeah. But this creates conditions where you can probe, experiment, look for new applications. So that actually fosters exaptation, or at least innovation that is driven by exaptation. Yeah.
Yeah, that's very interesting. Yeah, now I remember this little town because it's very little. All the people practically work in Corning farm. So I remember now. Yes, it's very exactly. There was a family, very nice place actually in the countryside. Beautiful, beautiful place.
Yeah, I think that.
But still, I was wondering. I mean, so what is disruptive ideas? No, something that comes from the scratch, from zero, are very few at the end, no? And from that, of course, you can create innovation, means to repositorying and do exaptation, create other things, but disruptive ideas at the end are very few, no? That's not so many, because even Corning, they started with these glass special just by chance. Someone invented it and no one used, but was a great idea. No one wanted to use. So that's still the first point. So how many disruptive ideas we had during the time? Few, I guess. No, not so many.
Yeah, that's a good question. You can argue that, for instance, if you study this particular case, the Kemper case, the Gorilla Glass, superficially fits Arthur's explanation, right? There is a specific need, you develop technology, correct? The problem is that the form, the technology, the glass in this case, was already there, okay? So in a way you can say Steve Jobs was the trigger not for the innovation per se. Steve Jobs just offered an investment opportunity, and also, more importantly, suggested that was a great market opportunity for Corning, correct? Because a smartphone was becoming so dominant. But the form was already there. So the innovation was not creating something new, was just understand that something that you had could be used for a different application, correct? So that's why, as we say also in the paper, because we make this example, the R was already covered. The development was the next investment, correct? You don't have to, you just have to adjust something, so you have to further develop it, but the basic form was already there. But you can think about the same thing in many ways for even the development of fiber optics that I discussed in my paper in ICC in 2006, actually. Again, Corning was approached by the British Post Office, and after to see whether there was any possibility to develop a glass fiber with certain characteristics. And Corning, understood that given the type of knowledge that they had, and also manufacturing processes that they had developed over time, they were well prepared to respond to that demand. Okay, and of course in that case you cannot say that there was already a form fully developed, but there were bits and pieces of knowledge here and there that Corning didn't have to develop from scratch. And I'm also talking about how to manufacture certain fibers. Okay, in that case, the form was not fully developed, but there was some form, something that was half developed that Corning could leverage. So of course, these are not necessarily cases that occur so frequently, but our analysis of Corning over time and how some of these different types of glasses, for instance, radiating into different applications is very frequent. It's very frequent. So what is less frequent is to develop these milestone technologies. Okay, then when you develop them, you can actually they can radiate into different applications. So where they are, let's say the basic research focuses on is being able to develop these new specialty type of glass that eventually might span radiate into different markets, into different applications. Yeah. That occurs quite frequently. Yeah. As I said, the graph that I showed you before is just one such example. I think I have another one here, if I remember correctly. So this is Pyrex, and developed in 1908, that was developed for cooking purposes, and then spun into many other applications over time. We have until 1950s, the last application, then Pyrex was discontinued. But all I'm trying to say is that you can see this for many other, I don't think that I have any other example, but this is exactly how the company operates.
Thank you so much. Very, very
interesting. And by the way, I think that even 3M, I don't know whether I have it here. There was, I don't think I have it here, sorry about that. But I mean, there is, even if you look at 3M, is pretty much the same logic. Develop technologies that are that have an inherent potential to be reused to other into different uses. Some of them may not be anticipated, okay, from the beginning. Others are understood. Others can emerge over time through interactions with lead users, if you want to use the language of Von Hippel. Sometimes is more serendipitous. Sometimes you know that there are applications that are possible, but the environmental conditions are not there, correct? Maybe you need to have other complementary components sometimes. And so when these components are developed, then it becomes more likely that you can, okay, now I can leverage this technology because the other, let's say, complementary components are available, or at least are up to speed with the performance of my technology, correct? So you can think about like even the electric car. I mean, it was unthinkable to develop a successful electric car 30 years ago, maybe when the electric batteries were not efficient, good enough to make an electric car attractive, correct? Or maybe there was not a recharge station available, so when you only had to recharge it at home. But if you drive a long distance, you don't go back home. What do you do? So I mean, it seems to be obvious, but this is exactly what might explain the timing when maybe a new opportunity materializes, correct?
That's very interesting. You know, that means that the people, that are more visionary, but were recognized later on. You know, actually, so Elon Musk, you know, was visionary, but it was successful when he was able to get to this battery.
Yeah, I think that this actually to that. These are very interesting. The electric car is an interesting context to look at. Even regardless of whether you use an exaptation lens, but there is a very interesting documentary called "Who Killed the Electric Car," which I also use in class sometimes to illustrate this basic point. But GM was the first car manufacturer to introduce the fully electric car EV1 in the 80s in California, because California was the first state in the United States to issue a mandate for electric car to reduce pollution, and but then the car was essentially killed by GM, according to the video. But the story is a little bit more nuanced and complex, because at that time, as I said, electric batteries were not really working well. All the other complementary goods were not available. In other words, recharge battery station, or even few mechanics who were knowledgeable about electric cars. How you fix a problem, correct? I mean, so when those things were in place, then it became much easier. But in many ways, the paradox is that GM was the first to introduce the first fully electric car that was also liked by the so-called lead users, so people willing to buy it and use it, but the conditions were not obviously there, and that's why eventually GM terminated the production of EV1. Correct? Probably now he regrets doing that, because if GM had pushed more, and at a time when GM was still the leading company in the world, probably things would be much better for them now. But that is retrospective sense making, correct?
Yeah, never give up. So trust yourself. Yeah. So thank you so much.
My pleasure.
Other questions? I see that people. No, I don't see any other hands up. Fine. So thanks a lot, Gino.
My pleasure. My pleasure. Yeah. And by the way, the paper that I sort of talk about today is forthcoming in Industrial Corporate Change. So there are some minor differences, but the basic messages there would be in print, or at least available online, I think, shortly. So, and if you have any questions, or you are interested in discussing anything, feel free to reach out to me. I would be more than happy to respond, or even set up a meeting, a Zoom meeting, if you wish.
Very nice.